Our rotator cuff repair module is a comprehensive repair of the supra and infraspinatus using arthroscopy. Precision score will be generated for your students if they skip no steps along the way. You can also, in the metrics panel, toggle the skin to view where our ideal placements are and remove the bone to get a closer view for yourself. Each of the anchors contributes to your precision score. We measure how far away from your ideal you had placed the anchor, as well as its angle of insertion. This is repeated for the anteromedial anchor and on subsequent pages of the metrics, the posteromedial anchor. The next metric you can view here is suture passing, both on the supra and infraspinatus. Both your anterolateral and posterolateral anchor need to be placed appropriately as well. And finally, as this is an arthroscopy-based module, the number of steps you do with the skin turned off contributes to your score. We'll now go through each of the steps and showcase what's actually done by the user to be able to generate these metrics. You can toggle the skin on and off at any time during the procedure by pressing this eyeball button just above the patient. This will allow you to directly visualize and view what's going on inside the repair at any given time without needing to use an arthroscope to do it. The portals in this module will also accommodate where you wish to place the scope. I can place it directly here, or I can shift it more anterior if I feel the need to, and that portal will be automatically created for you. Lastly, and quite importantly, I can mobilize the arm at any time to be able to visualize different views while the arthroscope is still inserted. I have my anteromedial anchor ready to be positioned. Importantly, in this module, there's freedom to place this where I feel is necessary. This freedom allows the learner to make mistakes and learn from it based on the metrics we supply at the end of the module. As I position this where I feel is necessary, I will mount it into position, and the anchor will see to it. Another important skill in rotator cuff repair is being able to manage sutures. We've done this by way of allowing users to grasp sutures and pull them out of the portals that are appropriate. You can see here that I'm ready to place my posterior medial anchor. I've positioned it where I think is appropriate, but as I'm not entirely sure where it is, I can always toggle the skin and take a close-up view to see exactly what I'm doing. Suture passing is another important aspect of this module. I want to be able to pass sutures through the tendons at a reasonable location. Visualizing it under arthroscopy can be challenging for some users. Getting it to a right depth to get a bite and passing the suture like that isn't necessarily an easy skill to acquire. As I work to place my anterolateral anchor, it's kind of hard sometimes to visualize this on the scope. The scope may not really give a novice user much of a good perspective on what they're actually doing. And once again, the skin toggle comes in handy here to see exactly where I'm positioning this. There are a few options to reposition your instruments in VR. You can either place them where you want the portal to jump to by holding down the trigger button. You could also move the arm while the portal is in use with an instrument. Or lastly, you can leverage off the bone to move the portal as you're visualizing now. Overall, for this module, I achieved a 51% precision score. This is based on a number of factors. My anteromedial anchor, as you can see the metrics here, and posteromedial anchor weren't far off from the ideals, a couple of millimeters at best. I can visualize them directly by pulling out the bone and seeing where I would place my anchors based on the suturing. I can also compare it to what the ideals show, and it does look like it's just a few millimeters off based on where I see the sutures. The next contributing factor is my suture passing, and both are marked as ideal depth. The last metrics, and where I've lost the bulk of my marks, are my lateral rows. You can see that my anterolateral anchor, while at first glance it looks okay, is fairly far off in terms of the ideal angle. The last component of my metrics is the proportion of the module I did with the skin toggled on. Only 72% did I do it using only arthroscopy. Users can take this module and complete any number of the steps. Steps 3 and 4 are going to be your majority of your anteromedial and posteromedial anchor placement. Step 5 is suture passing. 6 and 7, respectively, are your anterolateral and posterolateral anchor placements. Have your students repeat any of these steps over and over in order to build up competency in that specific skill set. Or have them complete the entirety of the module without skipping steps to generate that final precision score.